It's a good time to be talking about mental health. After all, the government has set itself an objective of parity of esteem between the way we handle physical and mental health. In other words, that means mental health services to be available to all without stigma and discrimination. And of course, only last week we had the 10-year plan published showing how we're going to spend all the extra money that the NHS is going to get. Now, these are important developments, but the good intentions embodied within them are unlikely to be enough to change the realities of people's lives without a significant rethink. But they do offer, as I say, an opportunity for discussion, an opportunity to perhaps put a foot in the door about the reality of people's lives, as I say, particularly in low-income communities, and the impact that mental health has on these communities, and indeed with the relationship between these communities and public services, including primary care and GPs. You don't need me to tell you that these are complex and deep-seated problems, and they will require new approaches. I think notably in the way people's voices are heard. That was always an issue for me at the Department of Health. This was people's views and feelings about how they saw their health and well-being were never fully articulated or at least incorporated in some of the work that we were doing. So doing justice to that is difficult. And that's something we need to take greater account of, and indeed is something that needs to have a greater acknowledgement in the validity of their experience as patients and as people, making them sort of fully engaged in the whole process of their health and well-being. So this first issue of the patient experience raises other issues in relation to the professionals, and as we say, we're looking particularly at GPs and primary care staff. And we know that these professionals have been much put upon in recent years by growing demand and other service pressures, which has in turn raised questions about the efficacy of what is delivered through the health service and to patients. And for mental health, it begs the question of medicalisation. What is a medical problem and what is not? Where do we draw the line? How do we take account of the wider factors that shapes people's lives and their health? How far is prescribing the right approach to actually dealing with those issues? And then thirdly, there's the impact of austerity itself, which complicates an effective response. It exacerbates the poverty experienced by individuals, families and communities as a result of welfare reform. It weakens at the same time the social infrastructure by reducing social provision and access to those services, which again then reinforces and intensifies the pressures on the NHS front line. And you could say even exacerbates the well-established problems of the inverse care law. But more corrosive is a growing sense of stigma that surrounds poorer and more vulnerable sections of our community. A sense of being judged by others can only reinforce the sense of powerless which many of us even feel, which alienates them from the services best placed to serve them, and has the effect of widening the already unacceptable health inequalities gap. It's almost reminiscent of the old days when we talked about deserving and undeserving poor, which did us very little good, when we should really be talking about we're all citizens of one country. But anyway, so I think these are three of the reasons why this conference is timely. And firstly, through the light it shows on this intriguing combination of factors that actually bar and prevent people from the health and well-being they should enjoy, and through the possibilities of engaging patients, communities and professionals in different ways in the health process. Co-production is sometimes used as a word to describe this. And finally, the opportunities of developing more effective policy and practice. So this is not the first project that's ever explored these issues. The scope of the sessions and the range of the speakers we have bear witness to the considerable knowledge and experience that is actually out there. And I hope that we can, through this conference, add to that and add to the knowledge base, and that we can together develop a conversation that will help with the sharing and learning from the latest research, help us with the questioning and thinking afresh about current approaches and practices to mental health, and finally by widening our horizons about what makes health and the factors that shape health inequalities.